This is Dr. Timothy Lineski with Lake Cumberland Rheumatology. Wanted to talk to you guys about some of the top vitamins that are out there available to help you with your rheumatology needs. Number one is probiotics. There was an excellent small study that people don't really discuss where they took rheumatoid arthritis patients who were on a stable dose of methotrexate and started half the group on probiotics and the other half without, and followed them for the next 3 months. Turns out that there was a significant improvement in their rheumatoid arthritis when the patients were taking probiotics. And it kind of gets into the old thoughts in regard to a good feeling gut is a good feeling patient. You have to remember the vast majority of your immune system's interaction with the world is through your gut. I tend to joke that essentially as humans, we are nothing but a tube with a bunch of organs and skin wrapped around it. So the better you are to your what goes in your mouth, the better you are for your whole body, including clean eating. Number two is vitamin D. There have been studies about vitamin D deficiency being extremely common in rheumatology patients. Upwards of 50% of people who walk into my office have a low vitamin D. Vitamin D works for bone strength, but it also acts as a hormone and can help with muscle weakness and reduce the risk of fall, especially in the elderly. It has been shown that in lupus patients who have a low vitamin D, that they do worse than patients who have a normal level. Number three is omega-3 fatty acids. There have been clinical trials in both rheumatoid arthritis and lupus where if you begin omega-3 fatty acid supplementation, that you will have an improvement in your arthralgias, which is arthritis pain. Number three, vitamin C. Vitamin C is good for gout. Actually, it causes uricose-uric properties, which means you pee out your uric acid. People use tart cherries, high doses of that to help with gout. Turns out that the tart cherries just have a lot of vitamin C. 500 milligrams twice a day will actually lower your uric acid by about 1/2 point. Now, that's not enough to get you where you need to be, but it will help improve you to lower your gout flares in the future. Next would be vitamin B12 and folate. We use folic acid very commonly for liver function protection on methotrexate, and a significant amount of patients are on methotrexate for various autoimmune diseases. So remember to take your folic acid, generally 1 milligram every day, except for the day you take your methotrexate, because it'll block the effects of the methotrexate. And when it comes to B12 is a vitamin that can help with fatigue and is not uncommonly low, especially in patients with Crohn's disease or any gut disorder. In addition to those, vitamin E has been known to help boost the immune system. There aren't a significant amount of clinical trials, but there's a lot of empiric data that suggests that this helps. If you have any ones that you've tried or want to make a comment, go ahead. You can see us at Google Lake Cumberland Rheumatology, or give us a like on this on our YouTube and these other posts that I'm trying to fit together and understand how social media works. So forgive me if I don't click on your buttons, but check me out also on Dr. Lineski with Facebook, and I do interact with my patients and try to give some tidbits as much as possible. Hope that was helpful, guys, and it was under 4 minutes.